Sure, it's my first.
Breastfeeding is a big commitment.
The decision to keep up with it was difficult once we kind of figured out the realities of what we had to go through to be able to breastfeed them, but definitely wanted the nutritional benefits to them, and I really enjoyed the bonding with them.
The health benefits for both baby and mom are countless.
For babies, it's the gold standard source of nutrition. That babies grow at the right rate because of the immunity that they get from breast milk. They have lower rates of infections, ear infections, colds. There are lower rates of obesity, lower rates of serious diseases, including diabetes, and even evidence that it lowers the rates of conditions like leukemia. So there's benefits for moms as well, that they more quickly return to their pre-pregnancy weight when breastfeeding, and they have lower rates of breast cancer.
The American Academy of Pediatrics recommends breastfeeding exclusively for the first 6 months. If you're considering breastfeeding and using a pump, it's important to talk to your doctor and a lactation consultant for tips that'll work best for you and your baby.
I try to meet with the moms and the new babies at the initial visit when they visit the pediatrician, but particularly on that second or third day after that for a weight check. I help the moms go through what normal feeding behaviors are and what they can expect, and we check the baby's weight to make sure that the process is going well.
Utilizing a breast pump is also an option.
I started pumping when I was in the hospital right after I had them to establish my supply, because a lot of times smaller babies, which multiples are usually smaller, don't eat as well or as good as some bigger 40-week-old babies. So just making sure that you get your milk supply up and not afraid to pump and not afraid to store that and give them bottles if you need a break.
Experts say start off on a schedule as you figure out what your babies need and want.
Early on, I think that we need to have a schedule per se as far as at least 8 feeds in 24 hours. Sometimes it's every 2 hours, sometimes it's every 3.5 or 4. The main thing is we don't want to be too rigid with the schedule, because sometimes babies get hungry sooner.
Especially if you're breastfeeding twins or multiples.
When we started out, they were on a schedule of about every 2 hours, if not more frequently, so at this point they're kind of on demand. And I just let them kind of guide it.
It's common for breastfeeding moms and babies to face challenges, from feeding positions and patterns to ensuring an adequate milk supply.
Just getting them to feed at the same time and making sure that you keep your supply up, and I think just getting all that coordinated at the very beginning is the hardest thing, and then after that it's kind of, you just are on coast, and it's easy. It's actually easier to breastfeed 2 babies than to bottle feed 2 babies.
Making healthy lifestyle choices can help, such as eating a healthy diet, staying hydrated, getting plenty of rest, not smoking, and being cautious with caffeine, alcoholic beverages, and medications.
So it can take a matter of weeks before the mom is really feeling comfortable that she knows what she's doing. So setting realistic expectations is one of the most important things.
Getting the hang of breastfeeding takes time, so remember to be patient and think positively.
When somebody said to me, "Oh, you're going to try to breastfeed your twins," I said, "I'm not going to try, I'm going to do it."
Christina Muchler, CNN.